on disability services. I will start, as always, by sharing our current data. So since last week, we have had one additional person test positive for COVID. Our total in the month of February has so far just been one person. So by placement type, in a correctional facility, there has been one person. In host homes, 14 people. In intermediate care facilities, 126 people. Mental health facilities, one person. Natural home, 116 people. Nursing home was 2 people. Out of state placement, 6. In residential habilitation, 50. And in supported living, 296. So in ICFs, those 126 people represent about 42% of people who are in ICFs who have contracted COVID. And of those, we have had 28 deaths. However, only 13 of those were confirmed COVID deaths. Which reflects a little over 10% of people in ICFs who contracted COVID and actually have a confirmed COVID death. In natural homes, the 116 people reflects about 13% of people in natural homes who have contracted COVID. We have had 6 of those people die, but only 5 are confirmed COVID deaths, reflecting about 4%, a little over 4% of people in natural homes who contracted COVID and had a confirmed COVID death. In residential habilitation, the total is about 46% of people in residential habilitation who have contracted COVID. Amongst those 50 people who have contracted COVID, we have had 3 deaths, but only 2 were confirmed as COVID-related deaths, representing about 4% of people who contracted COVID and had a COVID-related death. In supported living, the 296 people reflect about 31% of people. 27 of those people have died. However, only 15 are confirmed COVID deaths, representing about 5 people in supported living who contracted COVID and had a confirmed COVID death. So overall, of people supported by DDA, the 612 people who have contracted COVID represent about 25% of people supported by DDA. We have had 68 deaths. However, only 37 of those are confirmed COVID deaths, representing about 6% of people who, among some people supported by DDA who contracted COVID and had a confirmed COVID death. So as I said, in the month of February, we've had one person so far, and that one person was in a natural home. And that person did not require hospitalization. So currently we have no people hospitalized receiving inpatient care for COVID. As I indicated, we have had 68 people who had contracted COVID who have had confirmed COVID deaths. However, we have had confirmation that 24 of those are confirmed as not COVID related, and we are still awaiting confirmation of the cause of death for 7 people. And so the total number of confirmed COVID deaths is 37, and the last confirmed COVID death that we had was in March of 2021. Amongst staff, we are now at 1,001 provider staff who have tested positive for COVID. 61 of these have been reported by more than one provider, and we have had 10 staff die from COVID. In terms of vaccination, among the people that we support, 87% have received their vaccinations, 95% in host homes, 99% in ICFs, 76% in natural homes, 99% in residential habilitation, and 93% in supported living. People who have received boosters, we have 1,894 people who are eligible for boosters and 1,220 people who have received those boosters. We are continuing to reach out to providers to make sure that not only reminders about the importance of getting people boosters, but also speaking to people about uploading the documentation so that we can track the number of people who have received their boosters. At this time, by placement type, 91% of people in ICFs who are eligible for a booster have gotten it, and have it documented. 73% in supported living, 69% in res habs, and 41% in natural homes. Amongst provider staff, we are at 96% of provider staff who are vaccinated. And amongst DDS staff, we're at 95%. For people who listened to our hearing yesterday, I responded to a question regarding whether we are tracking provider staff and their status regarding boosters. And my answer at that time was that we don't track that at this time because the requirement, as I understood it yesterday, was that that licensed healthcare professionals or direct care staff who work in any of our programs have either the 2 shots of the mRNA vaccine or the 1 shot of the Johnson & Johnson vaccine. There was an emergency regulation published this week by DC Health that requires that all of those people have a booster shot when it is required, which would be 2 months after their Johnson & Johnson or 5 months after the Moderna or Pfizer, and that they be up to date, including a booster, by March 1, 2022. And so we will begin in the middle of March to be tracking the compliance with boosters. It's a little more complex to track only because you have to track a number of things, including, whether you are eligible for a booster yet. And in addition, if you have had COVID within the last certain number of days, I don't know that they recommend a booster. So it will require, there will be more information, I expect, coming out from DC Health in the next week or two about this requirement, and guidance about how to ensure that staff comply. We did receive, as people logged in, a question. And just as a reminder, anyone can type a question into the chat. Just make sure that you type it into everyone so that we can see it and be able to respond as best as possible. And as always, we do have our colleagues from DC Health here. So if you have questions for us or DC Health, please type them in the chat and we will do our best to respond. There's a question: can family members still be selected as the staff for companion services? It says there was an extension of this till December, but I wasn't sure if it was extended. This flexibility was included in our Appendix K, And so it is still in the Appendix K, and we are allowed to maintain the flexibilities and enhanced rates included in our Appendix K until 6 months after the federal public health emergency ends. And so that flexibility is still in place, and we expect it will remain in place um, until 6 months after the federal public health emergency ends. So, what is the guideline for getting the booster after having COVID? There's nothing specific on the CDC site, and doctors' offices vary. Um, Nelson, do you know that? Because I thought the CDC site did address that.
I'm gonna see if I can find the link and post it in the chat. I think that it'd be helpful for people to read it because, generally speaking, as soon as you've recovered from COVID, you can go ahead and get the booster or continue with your vaccinations. But there are some requirements for those that have had monoclonal antibodies and convalescent plasma and things like that. And so there are some times where you would need to wait. So let me find that link and I'll put it in the chat.
So last week, Nelson, we missed you. As you know, the guidance was updated regarding, well, you know what guidances were updated. And of particular concern that people have had, as they've expressed before, is the inclusion of supported living in the requirement to quarantine for 10 days following an exposure. And the folks from DC Health said they were going to bring that back to the policy team. And I'm hoping they had an opportunity to do that. And I don't know if there was any discussion of that requirement, or if you can speak to the decision to keep that requirement in the guidance.
So I can speak to some of the details for that. Throughout the pandemic, we've taken vulnerable populations and grouped them together, and supported living was included in that group of those at most vulnerable for severe illness. The reality is that while the CDC has made these rather what are drastic changes to recommendations for the public, there is still some risk involved, and that is why, even though after 5 days there's a requirement to wear a mask and things like that, because there is still risk that you can be infectious, after having COVID, and there's also still, high risk for converting to be COVID positive well after 5 days, and so when we make decisions to make those types of changes, which went from 14 to 10, which is a significant change for all of that population currently. We look at our data to see how many of our of those within certain populations are converting and at what day they're converting while under quarantine. And we also look at national and local other local data, as well as other science and epidemiological factors, as we consider changes to local guidance. And so those are some of the reasons that at this time we've decided to continue to keep that population group together.
And I don't know when DC Health's performance hearing is. I do know that Council Member Nadeau is on that committee and said she would be raising this issue. So you might want to let people know that. And I will also let the director know that she'll be to expect a question about this. With the current proposed rulemaking on boosters, can DC Health share some feedback on where they are with approving medical and religious exemptions? Do we continue to accommodate those employees that requested an exemption until we receive feedback from DC Health? I can answer the second question only. Yes. So until you know that an exemption request was denied, um, you would continue to accommodate them. I know in the district government, what that means is that people continue to test weekly, um, which would be for us the same requirement that they would have if they have a medical or religious exemption from having the COVID vaccine. Um, the status of those exemption requests, I don't know. And I don't know if anyone here from DC Health knows.
Um, Director Reese, there's a special committee that handles that, and I'm not, I don't have any further information.
Okay. Oh, okay. So I'm sorry, we had gotten this question in advance. Um, and so we do have the answer. In order to bill for the quarantine rate authorized in the Appendix K, do we need approval from the QRS, or is it sufficient simply to notify the QRS that we plan to bill the quarantine rate based on positive cases in the home? We've had a few different experiences in getting the rate authorized. I'm just wanting to confirm the correct process. My understanding, and Winslow may want to correct this if I'm wrong, but my understanding from our discussion was if you are submitting a claim just for the quarantine rate, not quarantine overtime, you would just use the proper code and submit that to DHCF. You are going to need to make sure that you maintain documentation that in fact there was a person who was quarantined at the time, and you have the documentation to support that that rate was justified, and you submit that to DHCF. They're not asking for anything from us that I'm aware of when you submit your claim with a quarantine rate. We have to provide documentation to DHCF if someone uses quarantine overtime. And in those instances, what we're looking at is simply that the staffing was necessary for overtime. And so Winslow and Shasta are both here. I don't think those do require approval or notice to the QRS. Notice to the QRS is helpful because the QRSs should be aware of what's happening in your various placements. But submitting a claim doesn't require.
You
Um,
you you covered it. You covered it exactly, Director Reese, the way the process works. We don't approve billing for quarantine usage. Um, with regard to overtime, we are required to uh, approve that or submit a package to DHCF approving that overtime. And to be clear, if two staff were scheduled on a shift, but only one worked, and then two staff were scheduled on the relieving shift and one worked, because you're exercising the discretion with regard to staffing as relates to quarantine and or isolation, you really have to show me that you have paid two shifts. So, in other words, if the staffing is two people and and one of those staff people didn't show up, but you paid overtime to the one that did, you can't bill for that person's overtime under the quarantine uh, um, uh, guidance submitted to me, because I need to see that you paid a full authorized amount to your staff prior to paying you additional overtime, because you had one staff that worked and made more money and the other one didn't work at all, because you got paid for two people to be working. But anyone who wants me to have an individual discussion with them on that, I'd be more than happy, because it is sort of complicated.
So there's a question regarding the exemptions. Isn't it the case that the providers will not hear from DC Health, only the person requesting it will hear? That is true. What efforts are providers expected to make to learn about the determination? Should providers be regularly asking their employees if they've received a determination on the exemption request? For one, there isn't specific guidance about steps providers need to take. I will also say that the regulation is, in terms of um, what providers can do, is the floor. The mayor's order, and each of the mayor's orders has said this. And we, in fact, have a provider since December of 2020 has had a mandate for vaccines for all their employees and has managed that perfectly well throughout without any of this guidance. Um, uh, and has managed with their employees the discussions about whether the employee would qualify for a religious or a medical exemption. And so is it a good idea to check in? Yes. If you have an employee who then reports back to you that they've received the exemption, and then you see other employees who are still not reporting back, that might be the time to start pressing. Um, the reality is the numbers we've heard so far, because of the number of exemption requests, I do think this is because of the number of exemption requests and the fact that each individual request is considered individually. And so it is taking some time for all of those to be considered. You're still in a place as an employer of taking whatever steps, you can to continue to ensure the health and safety of people that work there, including, of course, it's not in the regulation, but each provider, as the district does, can require that people test regularly. So, it is kind of up to each of them. When our folks are doing monitoring, they will look at whether people are vaccinated or if they've requested an exemption. I'll also just remind people, we are at 96%. So we are talking about a very small percentage of the people that are left. We'd like to get to 100, but we're certainly not going to get to 100, because there will be some people who have a medical reason that they cannot get the vaccination, and there may well be people who have a sincerely held religious belief that impacts their ability to get a vaccine. And in those cases, that will keep us from ever being, I expect, at 100%. We're at 96. We'll probably boost up a little more than this. The other thing is, for a small number of staff, for the nursing staff, they are licensed professionals. And so all of us who hire licensed professionals check their license as those renew. And it is at renewal time that the person would have to have proven that they are in compliance with this regulation. And so the employers would need to be checking that. There were January 21 retainer claims denied because of filing limits. However, the updated retainer notice was sent to providers in late 21. Providers didn't have enough time to submit those claims. I'd have to look at, it was in ARPA, the retainer that was authorized, I thought was just 1 year. We'll have to look at that, and maybe someone can be pulling it up while we're here to look at exactly what was authorized in terms of the retainer payments. What was issued in late 21 was, and when you say you had January 21 retainer claims, I assume you mean January 22 retainer claims? Because the retainer payments were retroactive to January 2021. Oh, or did you? Yeah. Maybe you waited more than a year to file the claim, and that's why so that would be a DHCF question. And the notice, what I was going to say, the notice in late 21 was of it included the new retainer rate. We don't have retainer payments at this time, but DHCF included the retainer payments in the new rates. In the event we have retainer payments again, the rates are already there, but we don't have authority for retainer payments beyond 2021. Submitting a claim more than a year out, that would be the problem and here I'm speculating. If there are claim problems, I believe those are directed to DHCF. And if Hakima is here, I'm not sure. But I believe that if you have claim questions, that those go to DHCF. In-home supports and companion services are basically the same service. Family members can provide in-home support according to policy. Why can't family members provide companion services permanently? It's more person-centered and mirrors DDS's core values and beliefs. These are comments that can be provided as we renew the waiver. I think that the explanation of that is that the kinds of activities that one engages in as part of companion service, and maybe Winslow or Shasta could supplement this answer, but from my understanding, the kinds of activities that you engage in are the kinds of activities that typically within a family one would be engaged in. And so paying someone to, watch movies at home, to hang out with someone, to go to the movies, that's what families do. And that's why we don't pay for that. It's not considered kind of above and beyond. But Winslow, maybe you can give more detail. We did expand payment for companion during the public health emergency because people were needing to provide supports for their family member beyond the typical hours that they'd be providing supports.
No, that was correct, Director Reese, with regard to the explanation of why it wasn't initially included. And second, there was consideration for the fact that some families, as a result of the public health emergency, had concerns about people coming into their home who were not a part of their family circle. So there was that, and there was also a need for the service to be provided. So to your point, those comments can be taken into account as we renew our waiver. But it is my understanding that the services provided in companion are, as you stated, you know, what we would expect families do with their family members aside, and to pay people to do that when family members have to work and or are unavailable to provide those services. And just additional comment to that last point, if a person is receiving in-home supports and the family could be providing that service to them, that's a discussion that we need to have, because in-home support is not to replace support that is considered natural by a family member. It is in addition to and or so if you're unable to be the support to your family because you worked all day, um, and you have another commitment in the afternoon, then we would use in-home supports. If you're not working or you are able to support your family member, as we all do, there should not be a replacement of the natural support to use in-home support. Waiver requires that we use all natural supports and all external services provided either through government entities or private, nonprofit, and others before we use the waiver. So if it's been misunderstood that you have in-home support while you're home as a family member and could be providing that, that's additional discussion.
And so we've posted the transmittal that went out regarding the retainer payments. The second round of retainer payments authorized an additional, it's essentially 90 days of service, retroactive to January 1, 2021, ending December 31, 2021. And so for 90 days of service during that 1 year period, it seems to me the problem probably is if this provider included claims from January 21 and didn't submit their claim until January 22, that was a year out and that was too late to be submitting a Medicaid claim. But you do have 90 days of service that can be reimbursed, assuming that the person had been authorized for day and was unable to participate in day for 90 days of service in that 1 year period. Now we're up to February, so you would be talking about, from March through December of 2021, are there 90 days of service for which you could submit a claim? So Nelson has posted to the chat a link to the CDC information about that provides the data on administering COVID vaccines after infection, as well as other special considerations related to the COVID vaccine. I'll also just remind people, if you go to coronavirus.dc.gov, there is information each day posted about the various places where someone can get a vaccine. You can walk in and get it at those places. You go under vaccine to get vaccinated. And there's a list each day of the various places where there are walk-up clinics on that day where a person can get vaccinated within the district. And so, and these places, you know, as I'm looking at what's available today, it's until 7:30 p.m. tonight. And you can find places, I believe, actually 7 days a week, where you can get vaccinated. But I do know if you just go to this website, each day you can find a COVID center near you. You can find a vaccination site where you can get a walk up, where you can walk up and get a vaccine. So for people who need a booster, they are widely available. Okay, it's a little after 12:45. It seems that we don't have any other questions. If that's the case, we can go ahead and log off if anyone does have. The website for, I will type it in the chat, if you are needing to get a vaccine, if that's what you're talking about. Coronavirus.dc.gov, and then you go to get vaccinated. And I've typed that in the chat. And as I say, it is available. You check each morning to see which sites are available that day, and you can walk in. Today, there are 4 sites. Most days, there are more than that, but you can walk into any of those sites, and they actually have all 4 sites listed today, have all 3 different vaccines available, and for walk-in from 3:30 to 7:30. And there's also a list of resources down below that of all the other various locations where a person can get vaccinated in the district. Okay, well, Thanks for your questions today and have a great weekend, everyone. We look forward to talking to you next week. Bye.